All right, the recording has officially begun. Thank you so much. My name is Selena Dorme. I am the Engagement Coordinator for the First Nations Public Service Secretariat. This is our third webinar that we've put out to let First Nations share their experiences and measures that they've taken to address COVID-19. Before I introduce our speakers, I'm going to introduce somebody from our team, Bronwyn Geddes. She is managing our mentorship initiative and supporting us in a few other ways, but she's going to be helping us out on the back end. If you submit questions or have any comments in our chat, she can respond to you. If you have additional questions that you want answered live, there is a Q&A function at the bottom of your screen. We will get to that after the two speakers have done given an overview, and then we'll answer questions live. I do want to make a point of saying that this platform is really just for information sharing purposes. There is a wealth of health-related information out there put out by the other organizations and institutions that are mandated to do that. So the First Nations Public Service just wanted to help in some way and provide a space for communities to share amongst each other. All right, I'm going to introduce Erik Blaney. He is the Emergency Planning Advisor for Naut'sa Tribal Council. And we also have Christopher Derickson. He is the Chief at Westbank First Nation. Either one of you can take it away, whoever wants to start first.
Go ahead, Chief.
You sure? Go ahead. All right. Sorry, I'm just on a webinar. Sorry about.
No, it's because we booked this room at 12:30 for a departmental meeting.
Do we have Erik go first?
Yeah, Erik might have to go first here.
Okay.
All
No
right,
worries. You deal with your business there, Chief. Aja Chepot. My traditional name is Tiapthot, and my English name is Erik Blaney. I'm the Fire Chief for the Tla'amin Nation and the Emergency Services Advisor for the Naut'sa Tribal Council. So thank you all for joining in today, and thank you for asking me to be part of this webinar to share some of the things that we've been doing here, both locally in my First Nations community of Tla'amin up in Powell River, as well as the Naut'sa Tribal Council, which has 11 nations spread throughout the Salish Sea. So I've been a firefighter for 21 years and a fire chief for about 4 months. So new to the position, and got thrown in at one of the absolute worst times as we were just getting some of our planning and our teams assembled. Having said that, quick overview of some of the things that we've done at the Naut'sa Tribal Council is we've struck a emergency task force that is working with our communities throughout the Salish Sea here. The first thing that we did was a needs assessment, which we rolled out through a survey monkey, and we've had some follow-up calls with one of our administrative assistants. So what we're looking at is basically a roll call of our First Nations communities and finding out how they're managing, how they're coping, and what their specific needs are within the communities. And also trying to figure out how we can support them further. So some of the things that we've looked at was doing our virtual EOC management, so assisting them with their emergency operations centers set up, assisting them with filling out some of their EAF forms, and trying to ensure that their tracking methodology was put in place so that they had a better chance of getting reimbursed from EMBC or Indigenous Services at the end of the day. So some of the other things that we've looked at was sort of procurement of goods and services. So I know a lot of our communities struggle with crowded housing. We have some communities that have 9 people in a 2-bedroom house. So looking at options for those people to have isolation tents sent to the community. So if somebody in that family unit does get sick, we can have the ability to deploy some access to isolation tents to that community. Looking at Gordon's Food Services and Cisco, a lot of the communities started running out of access to food. Some of our communities are remote on island. Some of them depend on ferries or barges to get their foods and goods and services brought in. So making sure that those supply chains were healthy and available for our communities was one of the first things that we really focused on to ensure that they had the proper access to food and medical equipment and medicine and that sort of stuff. So those are some of the preliminary things that we did and continue to do. We do daily situation reports with our nations as well. So we are calling them throughout the day. They're open to reach out to us 24 hours a day, well, to myself. And we sort of track those needs and assist the best we can from afar. So that's who I am, and that's what the NonSmall Tribal Council is currently doing to assist some of the nations. Some of the questions that were posed were interim funding. So I know Indigenous Services did release an amount of funding to every band in BC. That was given per capita. So that, again, that funding does not come out of the $300 million announcement. So that was available to purchase PPE or emergency food rations for your community. And that should have gone out, I believe, about a week ago. Another question here was about mental health during isolation. I know myself, we've been smudging 3 times a day, and just want to make sure that if people are smudging, to be very careful because we don't want to have any unnecessary structure fires due to unsafe smudging practices. As Coast Salish people out here on the coast, we do ceremonial brushings with cedar. So I'm recommending that people are taking up that practice. Drumming, we had drumming culture group last night, which was lots of fun. So we went live with our drum group. Everybody joined in at about 5 o'clock. It went on for an hour, and it was neat to actually hear the drums throughout the community of family units inside practicing their drumming and singing. Language, another one is firstvoices.com. So it's a really good resource for language preservation. So again, taking to computers, looking up your traditional languages and learning some of that stuff. Of course, having the kids being home all day is very challenging. Looking at ways that you could label everything in your house with your traditional language, and kids can learn, you know, how to say windows or doors or tables or that sort of stuff. My mom's been working on that for the last couple of weeks. Another question was ensuring access to food and water. So I know infrastructure is a big one for our communities. Ensuring that our water treatment facilities have enough chemicals or sand or whatever they need to remain in operation. Water service lines right now can be vulnerable this time of year with the ground thawing after being frozen. My community typically sees a number of water line breaks as we have the old asbestos line. So ensuring that your O&M departments actually have the tools and access to what they need to fix and repair those is going to be very important, especially if this goes on for some time. Looking at opening some of the accounts with Cisco and GFS has been very good, and that one delivery is made to the community. And there's essential staff at the band office handing out, you know, soups and dried goods to the community members has been great. I know some nations have given out gift cards for grocery stores. Again, this is good, but we need to ensure that people are using social distancing when they go out in public. Essential human resources, this is a big one for our communities, and that capacity is always an issue with a number of our remote communities. So making sure that your pandemic planning and your recovery planning is including succession planning. So if your O&M guy goes down and gets sick for 14 days or is in quarantine, do you know which key does what on their key ring? Do you know the passwords to their computer? Do you know how to operate your O&M duties without that person in that position? So again, there's a number of resources out there. I know First Nations Health Authority has some pandemic response planning guides available. But again, ensuring that your critical infrastructure, your finance, your community health nurses are in place, and you have some succession planning in case your systems get tested. Do you want me to answer these questions as we go, or are you tracking those?
I'm tracking them, but we can address them once both of you are done speaking.
Okay.
I would like to point out too as well, if there are any questions that we don't get around to answering live, you can actually pose those questions on our Facebook group. It's called the First Nations Administrators Network. There's a wide variety of people that are on the page, band administrators and other employees that work in First Nations that potentially could answer your questions if we don't get around to answering them right now. Erik, do you want to, are you about wrapping it up? Should we move on to Chris?
Yeah, you can move on to Chris, sure.
Great, thank you. Go ahead, Chris.
Thank you. I apologize for that. Apparently I'm in a room that's booked, so it's mine now. So I'm Ilmicham from Westbank First Nation. We're a community of about 840 members located in the interior of British Columbia. We're a self-governing First Nation, so we have our ministry we deal with is CERNAC, Crown Indigenous Relations. We also are unique in that we have about 10,000 non-member residents living on our reserve lands, along with 500 businesses located on our lands as well. Our response to the COVID outbreak started about the beginning of March, where we started to look at the pandemic that was starting to, I think at that point, become more of an issue here in North America. And we had directed staff at that point to begin putting in place a plan to respond to the pandemic. Of course, it wasn't but a week later that there was like a full-blown pandemic being declared, I believe, by the World Health Organization. And in response to that, our immediate concern was ensuring the continuity of our government. And so we took steps to ensure that the government could continue to operate well, practicing social distancing measures, and keeping, of course, the most vulnerable within our staff safe. So any staff members over the age, I believe it was 60, have been sent home. Anyone who was pregnant or had underlying health conditions were also sent home. So we're currently operating at about 75% capacity across our government, with staff being off. We are also gone to telecommuting. So right now, while this room, like I said, is booked, there's only about 4 staff here on the third floor with me in our government offices. And it's like that throughout all of our government buildings, with most people working from home or at home because they've been sent home because they're at risk of the illness. So we also made a decision early on within that first week to not lay off any of our employees. That came with as a great relief. A lot of people were concerned about their employment with Westbank. A lot of other businesses were announcing layoffs. The city of Kelowna, which is just across the lake from us, I think they announced it's 60 or 70 layoffs. And we came out, we looked at our financial situation and our ability to carry people through this and decided in the midst of this was not a time to begin laying off people. So regardless if you were on call or paid hourly, doesn't matter. If you were an employee of Westbank First Nation, you were going to continue to receive a paycheck for those on call and those who are hourly. We took an average of their last 2 pay periods paycheck, and that's what they'll be getting going forward. So that was a huge relief, because our ultimate goal here is, like for all communities, is to serve our membership. And we can't serve our membership if our staff aren't feeling supported and aren't here to actually perform the work. Along with that, we also instituted immediate relief efforts for our members. We got asked our corporate entities, Natiti Development Corp, to provide a dividend to our membership, which they stepped up to the plate and did. It was $250 per member to help alleviate some of the financial concerns and pressures we know members were going to be under. We also set aside a fund for $250,000 to address COVID relief efforts in our community for our membership. We also started to provide, so we asked all members to stay at home. We began last Monday with regular video updates, YouTube updates to our membership and the residents that live on our lands as well, encouraging them to stay home, to not travel unnecessarily out around the central Okanagan. And in doing so, we also asked our elders specifically to stay at home. So we started to provide daily meals out to our elders, gift packs and gift cards. The $250,000 we've set aside for membership. We're currently going through a process of setting up a policy in regards to how that fund will be accessed, what it will cover, and who it will be for. A recent Angus Reid poll that just came out anticipates somewhere along the lines of 60% of Canadians anticipating either have already lost wages or are anticipating losing wages or employment because of this pandemic. And 37% of those Canadians polled said that they could not absorb a $100 difference in income in their household, and are anticipating missing mortgage payments or rent payments because of that. So if you extrapolate that over to our membership and our demographics as Indigenous people, I think the impact will be much worse. So what we've set aside to respond to this pandemic over an 8-month period is what we're anticipating. If this continues, is not going to be enough. So we're currently looking at what more we can add or other resources we can look at. I know CERNAC has just released for self-governing Indigenous groups a pot of monies that is available to those First Nations in Canada. I think there's 35 of us that are self-governing. And that's about sums up what we've done here in response to the pandemic. I might be missing some things. Obviously, it's been a hectic the past 3 weeks, but I hope that was helpful, and I'm welcome any questions you might have.
Thank you both so much for that overview. We do have a few questions coming in. One of the first ones that was actually responded to in our chat was a question about whether or not there was, if the both of you, or no, this was directed at Erik Blaney, if there was help available to other nations that were not Salish nations, which was answered by Bronwyn in the chat. NonSmall Tribal Council supports 11 Coast Salish member First Nations. And then Erik, thank you for responding to her regarding the EOC's virtual management assistance. I wonder if you can talk a little bit about what that is.
Yeah, so again, a number of nations use Lightship to manage their natural resource departments. So Lightship is currently working with one of our contractors right now to set it up for a virtual EOC. So again, if nations are out there that are struggling to get a handle on setting their EOC up or need help with their daily action plans or their daily sit reps, there are people out there that are able to assist you through the expense authorization form through EMBC. So I do have access to a couple of folks right now. We have Steve Newton from InEmergence, who I've been working with for the last year and a half. And we also have a company called New Bello. They're actually out of West Kelowna. They're standby assistance for us for any nations who are struggling with their EOC setup. So again, as Steve said yesterday, Lightship is hair straight back, trying to get this launched ASAP. And once it is launched, we will have access to that, and we'll be able to tap into a number of other nations who need help with their digital EOC setup. So again, it'll have all the forms on it. It's map-based, so we can click on the community and look at setting the communities up that way. So again, I've checked in with Steve to see what his availability is, and we've got a couple other consultants out there that are able to assist with that once we have it set up.
Great. Thank you so much. The next question was, how are First Nations supporting post-secondary students that have been sent home from university or colleges or have had classes canceled? So either one of you can take a stab at it, or one of you.
I know for us, because it's the end of semester, a lot of those students continued to receive their student allowance that we provide on a monthly basis. In other cases, we know students that their program has been suspended, so they're literally sitting at home waiting for the call to get back to school. But we've, in those cases where we did have students being supported financially, they are still getting supported in terms of transitioning now, because they'll be going into the summer months. Those are the types of individuals we're anticipating will be accessing the emergency relief fund we've set up, because no businesses here are currently hiring, aside from, I guess, the big box stores still need people to stack shelves and have put calls out for hires.
Erik, anything you'd like to add to that?
Yeah, it's not something that I'm dealing with directly, but I do have a couple of family members who did return home from school. They ended up coming back to the community. They did get their last, I think it was a month or two worth of funding that was given to them by the band. And they were also given, I think it was a $500 move back allowance too. So I know that's kind of how my nation, I believe, handled that one. Yeah.
Thank you. The next question in the Q&A was, how is Westbank supporting businesses on their reserve during this time?
That's an excellent question. We've actually just sent out a survey to our businesses located on reserve, and within 3 days, we've already got over 100 responses, and that's out of 500 businesses on reserve. We're asking about their current financial situation, the challenges they're facing. So we'll have more information later this week or next week to compile, and then we can start addressing the concerns of business. I think a lot of our response will be just simply connecting them with the relief efforts being provided by the provincial and federal governments. We are also looking at, within the confines of our tax bylaw, what we can do to defer tax payments or to put businesses on payment plans. We know that, well, I just look across the street at the parking lots and they're empty. And the small business owners are the backbone of any economy. So we're going to be doing everything we can to support our local businesses and working with our partners on the shopping centers we have on reserve to see what we can do to alleviate rents as well. But I think there's going to be a lot of hard hit small businesses out there, and we're going to need to do something as a nation to help them out.
Yeah, great. Thank you so much. The next question is, I'm not sure if you can really answer it, but you guys can give it your best shot because you're not employment labor experts. But the question is, can we get in trouble for discrimination for sending home the at-risk elderly and pregnant, even though we're doing it with a good heart? So I guess it's kind of, what measures have you taken to kind of just address the elderly, the vulnerable members in your communities?
Well, I think it's just that is protecting your most vulnerable and people with compromised immune systems. So there's always the legislation there with people having the right to refuse work. So I also own the gas station in my community here, and we've just had to lay off 17 staff. Very tough decision. But again, we were losing sort of those elderly staff first, and then people that had asthma or other weakened immune systems, to the point where we were down to about 2 or 3 staff left. Again, one of the things that was challenging was that they didn't have enough hours for EI. and they wouldn't get EI unless we closed the doors. So we've actually had to make the hard decision 3 days ago to close the doors to our gas station for now. And we're just looking at ways at how we can reopen in the next couple of weeks here, as soon as this all simmers down a bit, I hope.
I can't provide legal advice, but I can say we did have legal advice when we made that decision to send people home. I think it's about their occupational health and safety. They are still getting paid in our circumstances, so it wasn't like they're going to be losing out on wages or employment. But the health and safety of our staff and our members is a top priority for us. So if they feel discriminated against, I'll say we spoke to our lawyers.
That's fair. And next question is the Westbank YouTube channel public? I guess you guys have been sharing some information.
Yeah, we've been updating. Last week I did daily YouTube updates. This week we're doing Monday, Wednesday, Friday to our members and residents. I'm not sure. I'm not on all the socials. I just actually hopped back on Instagram and Twitter. Was it last week? Mm-hmm. Just because of this pandemic, to communicate with members. So I'll find out. And if you do go to the Westbank First Nation website, there's a COVID banner at the top. Click that, and there you might have access to the YouTube updates there.
Great, thank you. Next question was, sorry, I need to scroll down. How closely are people adhering to the social distancing requests? Are you finding that some people are refusing to comply? On a related note, is mental health and wellness a current concern?
I was at the store yesterday. People will not walk down the same aisle you're in when you're in the grocery store, I've noticed. Other people are wearing gloves. From what I saw, people are following those social distancing protocols. However, we're still seeing people go out and about, and our message is clear to our members and residents is to stay home. I think if you start to mix that message with, you can go out and exercise, or you can go out and go to the bush. I mean, that means going out to the bush, stopping at the gas station, maybe stopping for a coffee. You're still in contact with other people. So our message is simply just being stay put unless you absolutely have to go out for groceries or medical necessities. If you do need to stay in contact with your loved ones, social media, Facebook, or even I say we can learn how to use the phone again and call each other.
Yes. Erik, do you have anything to add to that?
Yeah, I think up here we're dealing with a little bit of a different crowd in some of our communities up on the northern Vancouver Island and up in Powell River here. So we got a lot of people up here who don't have access to either internet or TV. So they're actually pretty oblivious to the fact of what's going on in the world, which has been a major challenge. So like I said, my gas station up here on our reserve is the last gas station on Highway 101. And we've got about 400 residents living beyond our community. A lot of them don't know what's going on. They came into the store and were wondering why the girls were wearing gloves and masks, and why we're closing our doors for a bit. So we're dealing with a bit of that sort of challenge up here with some of the more bush style folks who are living up here. It's not that they don't care, it's just that they don't know the extent of what's going on. So those people, they're not following those right now. No.
Yeah.
Mental health and wellness is a major concern. A big one for, one of our communities is they had a big distribution prior to the pandemic. So there was a lot of money circulating in the community, a lot of drug and alcohol issues popping up. And we're still seeing, people still have that money available right now. So we are still seeing quite a bit of excess drug use, and preparing our first responders for how to deal with that in the event of an overdose, because all of the protocols have changed in the community for responding to some of those issues. But again, it's definitely at the forefront, and we have our nurses doing a lot of community visits, checking on elderly, vulnerable, and as well as people who need access to, clean supplies for sure.
Great. Thank you so much. Next question is specifically for Christopher. You mentioned that you're continuing to pay your staff. How long are you going to continue providing this?
Well, we're a government, so like most governments, our funding sources are a little more reliable. So we're anticipating we can do this for the next fiscal. A lot of our wages do come out of grant funding, our tax base here in Westbank First Nations, and our own source revenues, along with our FTA dollars that we get. So as far as we're concerned, we're in good shape for the next year to be able to do that. And we do anticipate this, with barring any change in the circumstances, for the better. We're seeing this going on for the next 7 to 8 months, and
right.
The recovery, into the next year.
Right. Thank you so much. Next question is, what are you finding are the best ways to communicate with members during this time?
We've had a lot of good feedback with our communications through YouTube. It's a bit outside my comfort zone, so I've been learning to vlog over the past couple weeks. And I've had some help from my son, who is in the film industry and has the equipment to do self-takes, so he's been helping me film the last couple, so they've been getting better. But we've had a lot of good feedback from that. Council has come and helped me as well. We're also using our website, our social media pages, and regular mail outs to members with COVID-19 updates and things that the government's been doing.
Great. Erik?
Yeah, so what we've done at NonSmall Tribal Council is we've set up an ongoing webinar. So we're having webinars just like this one here with our member nations. So Friday, we've got one that is talking about how to fill up the EAF forms, how EMBC is set up, and what to sort of expect from EMBC with respects to reimbursing some of your costs. So I think that's the biggest one right now for a lot of our nations. We have a few of our nations who have no own source revenue. They have no business on their lands. So those ones are going to be the most hard hit. So we want to ensure those nations have access to the funds they need to assist them through this. With respects to keeping the money rolling in the communities, that's what we're going to focus on our webinar this Friday. We also have our website set up with the COVID-19 tab. So I've got a member of our team working on vetting the information that's coming in and that's online before it gets published on our website. So that's kind of how we're communicating. And then, of course, my job every day is to communicate with each of our communities' EOCs and assist them with some of the situation reports.
I wonder, any particular other measures for those community members that you said are remote and are not getting any type of information? Any thought on how to address that?
Yeah, so those communities, again, mine is one of them. They've gone to door-to-door delivery. So again, there was much thought put into that in ensuring that the person delivering the flyers had hand sanitizer and a mask if need be, and they had the proper PPE to get community flyers out. Some of the other communities that are more remote without phone access, they're using a placard system, just like you would see during a major hurricane or earthquake event. So they have placards on the windows for people saying they're fine, or they need more supplies, or they need immediate help. And then we have the community health nurses going around the community, checking on windows and checking on those placards sort of hourly.
Great, thank you so much. Next question is, how are you dealing with funerals or deaths in the community?
So my community has had 3 deaths in the last 2 weeks here, and we've had to make some major changes to our cultural protocols here in the community. My aunt passed away about 10 days ago, and we met at the funeral home. We had a small gathering of just immediate family. We all had a pew each. We ended up viewing the body sort of one at a time instead of as family groups. The next day, we met down at the waterfront in front of the church, and we had a gathering, which was basically just a large circle around the hearse, where we ended up doing the service. And we had our drummers who just returned from Ottawa drumming about 30 feet down the field. So that's kind of how we did the social distancing with that service. Again, very hard. People are mourning and grieving, and it's really hard not to give that hug. We typically carry the casket up from the church to the graveyard, which we're not doing anymore. So the hearse is now driving that body up to the graveyard, backing right up to the gate. And then there's only 6 guys who are now carrying the casket to the grave. Digging the grave, we're encouraging everybody to bring their own shovel, so people are not sharing shovels at the graveyard. We've suggested that they go to machine digging or digging the night before. So again, our cultural practices are kind of, we're talking with elders every day about how to do this and how to keep people safe during that process, and trying to keep to the cultural values. But it's becoming very difficult for sure.
We have fortunately not experienced any deaths since the pandemic started. So we're probably going to be, we did discuss it as a council in the event there was a funeral, what we would do, and we would deal with it on a case-by-case basis, because largely it's up to the family in our community what happens at funerals and how they're conducted. So we'd want to work with them to ensure their wishes are being met as much as possible, while keeping the health and safety of our members as a top priority. So a lot of what Erik said is probably things we'd be implementing as well.
Great, thank you so much. Let's see, 2 more questions over here. This question is for Erik. Is the gas station still open, the one that you were referring to, or is access to fuel vehicles an issue?
Currently, right now, my gas station on the reserve is closed. Again, all of our fuel comes in by barge, so challenging to get the fuel delivered out here in a safe manner. So we are closed at this point, but we will be looking at reopening within the next 14 days with different protocols. So whether that be pay at the window, nobody comes into the store, full serve. So again, looking at a full serve option for customers, so that there's only one person holding that pump handle. But as for now, the gas station is closed, and they're doing a full clean today with 2 staff. So everything on the store shelves is getting wiped down and cleaned, and things, fabrics, scarves. We have a gift gallery there. That's all being put away in case we do have to open again.
Great, thank you. Next question is, are any communities restricting non-residents? If so, how are you enforcing this? Is this a big concern for small remote communities with scarce resources?
Well, we can't restrict. We could, I guess, theoretically, but because we're so integrated to the local surrounding municipalities, it would be very difficult to do that. What we did do, I forgot to mention off the top, was we did close all public spaces on Westbank First Nation land. So these are parks, skate parks, our sport court and our community core, which gets a lot of use by both members and non-member residents. We did this a week before the local municipalities did, and we have law enforcement officers that go and enforce those closures. And I just recently saw they actually put fences up now to restrict people from using those facilities.
Yeah, so that came up again yesterday as well as the day before in some of the communications I had with some of our communities, and that they were setting up some barricades to the community. So again, talking to them about sort of what their authorities were and what the risks were. Of course, the risk to a community that has one way in, one way out. You want to ensure that firefighters and ambulance can actually get to the community in case of an emergency. So if they are putting barricades up, you should probably ensure that they are manned, and there is a way to open up access immediately should there be a fire or a health emergency within the community. The other thing is proper PPE. So if you now are on one of your community roads, make sure you have the appropriate PPE for those folks with respects to high-vis vests, high-vis barricades or cones. And if you're operating throughout the evening, you should have some sort of LED road flare out there as well, so that people know that there is a barricade in the community. So we currently do have one or two communities that are setting that up this week and restricting access into their communities. Enforcement is going to be tough. We do have a agreement with the local RCMP here in my community. Again, resources might become very slim. So they're planning on, they're not sure what their role is going to be if we start closing roads down and how they're going to be able to enforce access to the communities. So again, that's a question that needs to be looked at. And I'm sure further down the line, if this does, blow up, there'll be additional assistance to RCMP to help to restrict movement of people if it comes down to that.
Great. Thank you so much. Well, we have just about 5 minutes left. This one is, my community members are asking that we close our gas station mainly for the food portion of our gas station to non-First Nations. Any thoughts on that? My community members feel that the food that we do sell in a gas station should priority should be given to First Nations.
So that's exactly what we've done at my community gas station. So again, this is a different hat. This is the gas station owner now. So it's the first thing that we did was we pulled the food. We stopped doing food service about 5 days ago or so. We put any of the food that we have out back into our large freezers and fridges that we have. And we started looking at the elders in the community. So we took any of the food with a stale date on it, and we distributed that to our employees as well as the elderly in the community. So delivered coffee and cream. We've also been delivering any of the soups that we had on hand. And we've also offered our service to the First Nations health clinic in our community to access our account. So we actually can still bulk order a lot of that food for our restaurant and just sell it to the nation at cost to keep that food secure for the community. A lot of people depend on our little restaurant at our store for their daily food needs. So we did shut that down to the general public immediately.
Could I just comment?
Sure.
We're in a very different situation because we're much more urban, but we have seen a lot of panic buying, the unreasonable consumption of toilet paper. The most recent one I saw when I was there was no Tylenol on the shelves. And the government's been quite clear, provincial and federal government, that there's no disruption in the supply chain. So as long as people continue to purchase what they would normally purchase, there shouldn't be any empty shelves. The empty shelves are a result of people panic buying, seeing someone else buy it and stock up on that, and then going out and doing the same. We've encouraged our people to, have supplies on hand. There's no need to go out and worry that the stores are going to be shut down. Those are an essential service. They will not be shut down. And if people consume what they need reasonably, there won't be empty shelves. However, those First Nations, like Erik's talking about, where they're in remote areas, it's a very different situation because the supplies do take longer to get there, and of course they need to keep their elders safe. Even here with our elders, we're providing gift packs. We're not getting any special treatment from local businesses in regards to going out and buying in bulk for our elders. We're needing to still follow the same guidelines as others, and the store managers are finding ways to service us, but we're in this with everybody else, every other Canadian, every other citizen of BC, and I think we need to be looking out for each other at this time.
Thank you so much. We don't have any other questions. There were some comments in the chat just saying thank you to both of you for taking the time to share your experiences and what you're doing. I would like to make a point of saying that our next webinar is tomorrow morning at 9:30. Bill Guerin, the Associate RDG for the BC region of Indigenous Services Canada, is confirmed as a speaker there, and he will be answering questions related to ISK programs, emergency funding, reporting requirements, and anything else really that you can think of. So there will be a link that we'll share to that once we get that scheduled and shared all over our platforms like we do everything else. Other than that, if there were any other questions, again, you can post them to our Facebook group that we have, the First Nations Administrators Network. There's a lot of people on that page that work in First Nations that could potentially answer your questions. Again, we really just want to provide platforms for information sharing for communities. Thank you, Christopher and Erik, again, so much for joining and your time. Raise my hands to both of you and all your great work. Stay healthy and safe out there.
Thank you, everybody. It's been a pleasure.
Thank you.
Bye-bye. Bye, everyone.